Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
Best vitelliform disease. So, best vitelliform disease is an autosomal dominant disorder where the signs of the disease is more when compared to the symptoms. In best vitelliform disease, there is an accumulation of lipofuscin occurs in the retinal pigment epithelium. Thus, this retinal pigment epithelium is given an egg yolk appearance. In the later stages, scrambled egg appearance can be seen. Fluorescent angiography will show hypofluorescence occurs due to masking. Because of this scrambled egg or egg yolk appearance due to the accumulation of lipofuscin, this shows hypofluorescence due to masking. Then, this best vitelliform disease also shows autofluorescence or hyperfluorescence is also seen at the center of the retina. And on electrooculography, the patient can be severely subnormal during all stages. The electrooculography may be subnormal in all the stages in best vitelliform disease. Actually, in best vitelliform disease, this is the egg yolk appearance of the best vitelliform disease. Right. This is the egg yolk appearance in the best vitelliform disease. Then we have scrambled egg disease. So this is the scrambled egg appearance of the best vitelliform disease. Initially there is egg yolk appearance, later there will be strangled egg appearance, and finally there is hyperfluorescent lesion is seen at the center of the retina. So this is hyperfluorescent lesion seen at the center of the retina on fluorescent angiography. There is no effective treatment for best vitelliform disease.
thank you and thank you for watching.